Today we're here with Rick Grindrod, President and CEO of Provider Partners. Thanks for spending a few minutes with us.
I'm glad to do it.
So let's start at the beginning. Tell me how you got involved in long-term care.
Well, I got hired at the retirement community where my grandparents lived. And I started there. I was the 11th employee, and we grew from there. It became Erickson Retirement Communities. And ultimately, I was on the operations side of the business, responsible for 23,000 residents across the country.
Wow. It's interesting. I find a lot of people have a family tie that gets them started in the industry.
Exactly.
Well, the shift from fee-for-services to population health management is going to be big for the future of business in this industry. So what do you tell to someone just starting the journey or just starting to learn about population health models?
Sure. I would say two things with population health models. One is the underlying premise of population health is still great clinical care. And so to the degree that you are a post-acute provider, a long-term care provider, home health, delivering on great clinical care is very, very important. And in my opinion, great geriatric clinical care means identifying flare-ups of chronic disease early on and treating those flare-ups of chronic disease before they become such a big deal that the only option is the hospital. So really preventing that chronic disease from becoming something that requires hospitalization is key. The second thing I'd say is there are a variety of payment models out there. CMS, through their Innovation Center, is trying a variety of different things, and there are ways for post-acute and long-term care providers to fit into those models. They're not just for hospitals and physicians, although obviously hospitals and physicians are an important part of that. So I would encourage post-acute and long-term care providers to reach out to consultants, experts in the population health management field, and say, how can my organization fit into that value-based care model?
That's definitely something I've been learning, is that there are a lot of different options and sizes and plans, and everyone just needs to kind of find that one that really fits them best.
And I really believe that everyone can participate. That if you're committed to good, strong clinical care, then there is a way for you to participate in the value-based care models.
Well, the long-term care industry is wide and has a variety of different organizations and businesses. What are some of the differences for large organizations looking to make this transition versus maybe like the small independent owner companies?
Large organizations actually have the capital capacity, have the organizational capacity, and can demand, because they have many residents or patients, beneficiaries, they can participate almost independently in some of these models. Smaller organizations that maybe don't have as many beneficiaries and don't have the infrastructure, they need to look for somebody to partner with that's either also in a similar circumstance or is already engaged in it.
Well, this transition obviously includes kind of a mindset shift as well. So how do you get, upper management, C-suite level folks to buy in to moving into this population health management?
So the C-suite upper management folks that are responsible for the strategy of the organization, for the long-term sustainability and profitability of the organization, they need to be looking at the CMS priorities. And in those CMS priorities, they'll see that accountable care organizations are a key focus of CMS, that CMS expects 100% of Medicare beneficiaries to be in some accountable care, Medicare Advantage program by 2030. 2030 is right around the corner, right? So I also think that the leaders, the key executives want to look at these programs and say, instead of being reactive, let us be proactive. Let us engage, let us be part of the dialogue that's designing the programs so that we can offer our expertise in how to take care of those long-term chronic disease Medicare beneficiaries.
I love that, to see what's on the horizon and to be prepared for it instead of pulled along by it.
Exactly. And I would even go more, prepared is good, but I am really encouraging all of my colleagues, C-suite, long-term care organizations, to engage with policymakers, with politicians, with governors, with health secretaries, with CMS, with CMMI, and say, yes, you're trying to figure out how to solve a big, broad American problem, right? But we have a unique perspective and expertise on the most vulnerable population.